Dr. Melissa Olashansky, and I'd like to introduce you to one of the TMS coordinators at the Rochester Center for Behavioral Medicine.
Hi, my name is Ori. I'm one of the TMS coordinators here at the center, and I'm more than happy to help.
Ori, can you describe what an appointment looks like when somebody comes to Rochester Center for their TMS session?
Yeah, so absolutely. There's two different kinds. There's a mapping visit and there's treatment visits. Mapping visits only happen once. Treatment visits happen thereafter, and it depends on insurance approval how many there's going to be, but generally there's about 35. Now, the mapping visit involves placing the magnetic coil gently and non-intrusively on the patient's scalp, and we go through and we locate the appropriate location for treatment by observing either a slight twitch in the patient's thumb and index finger or the patient's foot, depending on their diagnosis. And this process generally takes 30 to 40 minutes, which is then followed by a 20-minute treatment. And then that's the mapping visit. All subsequent visits are normal treatment visits. So those subsequent visits simply involve placing the coil in the same location, again, non-intrusively and very gently, on the location that we found in the mapping visits, and administering the magnetic pulses. What we've had patients describe this sensation as is just a light tapping on the side of the scalp. And of course, during mapping, there's the twitching sensation, but during treatment visits, there's not going to be any of that. It's just going to be the slight tapping, and there's no twitching involved. No side effects on either of these visits are expected. The patients will be able to drive themselves home afterwards. It's going to be nice and simple.